All right, Tigger, it is time for you to take a little bit of medicine and a big cup of juice. Okay, do you want to look at more? Are you done? We don't have to look at any more, that's okay.
3-year-old Colby Brown is not having a very good day. Not even Tigger can make him forget why he is here. His mom, Bridget, never forgets.
Brown family?
In his short 3.5 years, he's had over 50 surgeries. We stopped counting at about 40. It doesn't seem to get any easier. There's always anxiety.
Okay, it's really big. Can you carry it? Okay, all right, let's head back here. Let's find your room, okay?
The Brown family knows from personal experience what far too many Americans know all too well: the high price a family pays for medical error.
We lost our first son almost 10 years ago now to a medical mistake. It was a surgical error during a heart surgery. And then when Colby was born, I nearly lost my life to a medication overdose. And Colby has had a medical mistake as well that nearly cost him his life.
You ready, Colby? You ready?
I didn't get a good night of sleep.
Ready. Yeah. You ready?
Dr. Robin Hatley will be operating on Colby this morning to correct a birth defect that caused his esophagus and trachea not to be connected.
What we have been doing is trying to plug this hole up between the esophagus and the bronchus using something called fibrin glue. And this is our 3rd attempt with it, and we're hoping this one here will do the trick.
After a couple of hours in surgery, Colby is admitted to the pediatric intensive care unit for recovery and observation. This is the area in most hospitals where parents have the greatest difficulty being part of the care team.
When I started, a family staying in the intensive care unit, that was unheard of. And whereas right now, that's the norm. And I think that's positive for the kid to look up and be around see a familiar face. Because I always tell people, can you imagine if you were sick and you never saw a familiar face? That'd be awful.
Mommy's gonna be asleep right behind you, okay? You need Mommy, just say, Mommy, I'll be right here.
When Colby was hospitalized this time, he started out in the ICU and then was transferred to a medical unit. It was during that move that problems arose.
He has 2 ports on his gastrostomy tube. One goes into his stomach and one goes into his intestines. And Dr. Hatley had wanted him to have nothing, even into his intestines, for 2 weeks at least. And I guess it was a young resident had written to start feedings up into his stomach, which could have been disastrous because it could go through that hole and into his chest. And so a nurse said, well, I see we're going to start feeding him into his stomach. And I said, well, you know, that just can't be right. And I talked to Dr. Christian. I said, you know, that must be a mistake.
We discussed it with the person who had written that order and made sure, you know, gave him feedback and made him realize that this was not what we wanted. And so, so it was a team effort. Ms. Brown played a critical role in that. And so I ran by and talked to Dr. Hatley about it, and he said he was okay with that. So what we'll do is we'll do the heparin in there, and we'll run it at 2 mLs an hour just to be on the safer side.
You just really need to be paying attention, and someone needs to know what's going on. It doesn't need to be a medical person, but you need to know what the general plan is and where things are going. That'll help prevent it from bowing at least.
Trying to get it to stick. Okay.
Got a sweaty little face. All done.
You gave me 5?